Good afternoon, everyone. Thank you so much for joining us this afternoon. My name is Tracy Harrison. I am the Associate Director of Admissions here at Emory Henry College, and we're really excited to be able to give you all information in regards to our new School of Nursing. With us today, we have our School of Nursing founding dean, Dr. Lori Ann Ferguson, and also Sandra Farmer. And I will go ahead and pass it on over to them and we'll get started. You're all welcome to type questions over in the chat as we go. We will be here to answer questions throughout the presentation, and also there will be time at the end to answer questions as well.
Well, thank you. I'm Lori Ann Ferguson, and I am really excited to share with you that we have started a School of Nursing here at Emory Henry College. We've had a Department of Nursing in the School of Health Sciences, and now we have a separate School of Nursing. And we are launching our traditional BSN or pre-licensure BSN program in addition to our RN to BSN program. So Grey's Anatomy is one of the longest running shows on TV. In fact, it might be the longest running. And there's lots of media characters of portrayals of nurses, some of which are stereotypical and not accurate. And some of them have increasingly given us an opportunity to get a better idea of the complexities of healthcare delivery and how everyone needs to work as a team to help improve patient outcomes and obviously to cure and save lives. So why nursing? I can tell you that I have never regretted my choice of career profession as a nurse. And when I entered into the profession, I have done a variety of things. And while I enjoy and really gain a lot of satisfaction by teaching, I have maintained a clinical practice because that hands-on touching patients is still important to me. But nursing, it's often under-recognized that nursing professionals comprise the largest number of healthcare providers within the healthcare disciplines. And it's more than just a list of tasks. So sometimes the things we see on TV or even in an observation, we think, oh, nurses give medications, they give bed baths, they start IVs, and that's part of what nurses do, but it's really broader than that. Professional nurses, registered nurses, are prepared at the diploma, associate degree, or the bachelor's of science in nursing. And nursing really looks at the holistic care of patients and their response to illness, as well as health promotion and illness prevention. So it's not just about diagnosing and treating, it's also about how do we help patients and families and communities become more healthy and live healthy and longer lives. So I chose these three individuals as some illustration of some of the kinds of career opportunities that nurses can embrace. So we often think of career opportunities including med surgical, in the hospital, in the operating room, labor and delivery, as well as a variety, emergency room, ICU, as well as outpatient settings, school health, occupational health, maybe in a professional healthcare provider's office. But as well, nurses practice in community and population health, working to help patients get better access to care as well as health promotion. But these three women really are stellar examples of other opportunities. Rear Admiral Susan Ortega, who also is a nurse practitioner and a nurse, is now the acting Surgeon General. So you may not realize that some of these individuals are actually nurses as well as their other roles. Dr. Mary Wakefield has held a number of positions within the United States government. She was an administrator in HRSA, Health Resource and Services Administration, as well as most recently was on the President Biden's transition team. And then General Clara Adams Ender, well, she's retired now, served as the chief of the U.S. Army Corps of Engineers, which Army Corps of Nurses, sorry, that comprises over 22,000 nurses who are in the United States Army. So these women are great examples of other opportunities within nursing and nursing leadership. So why Emory and Henry College? So Emory and Henry College is a well-known, well-established liberal arts institution that has prepared graduates for several hundred years now. And so the liberal arts education combines the power of liberal arts with the science of nursing. That's how I think about it. I know in my particular personal preparation, it was liberal arts that helped develop communication, written and oral, critical thinking skills, along with the science and coursework in nursing to prepare a professional nurse that's able to handle the complexities of healthcare services today. And we also are really, really blessed at Emory and Henry to have state-of-the-art facilities and simulation labs. At the health sciences campus, we really have simulation facilities that are extraordinary and exceed many, many other institutions nationally. As well as we have the Mel Lehman Free Clinic, which is right on the health sciences campus. So combined with the really high fidelity, very state-of-the-art laboratories and simulation labs, as well as classrooms, we have the opportunity to deliver education in a true interprofessional collaboration. There is more and more call, both from grant funding and for educational experts, to educate tomorrow's healthcare providers and healthcare professions in an interprofessional team environment, because we know, we have found, research has found that the more that different disciplines work together, that they improve patient outcomes. And so we have higher safety and outcomes, and patients do better. And so this interprofessional education and collaboration is truly unique. Some institutions have had to work across geographical boundaries, meaning one school or discipline might be at one campus and another at another. Here at Emory and Henry College, we're on one campus when you come to the nursing courses, where we have PT, OT, physical therapy, occupational therapy, physician assistants, counseling, et cetera, so that it really gives us a true interprofessional environment. And the health sciences campus, where the School of Health Sciences is housed, has a history of preparing other healthcare professionals, such as occupational health, physical therapy, physician assistant, et cetera. So there's a really a rich history of which we can build and collaborate with to deliver education. So this is a picture of the health sciences campus, and the School of Nursing is so new, we haven't even changed the outdoor titles or labels yet, but it is the health sciences campus of where the School of Nursing and the School of Health Sciences resides. It is a restored, updated former hospital building for Smith County. And so it's really been refurbished. And like I said, it's state of the art. We encourage you to come see it, because seeing is truly believing. As I talked about, we have really stellar simulation labs where we can have interprofessional education in a variety of settings. We have cadaver labs and really state-of-the-art facilities for learning neuroanatomy and anatomy, as far as learning to understand how the human body works and how that applies to our particular discipline. As well as the simulation labs are not just acute care settings, but also our outpatient settings, such as exam rooms in a health provider's office. And when we say state-of-the-art simulation, these exam rooms have cameras and recording capabilities, so they can be recorded and students can have really real time, as well as review feedback about how they are doing and where they can make improvements in their communication and their physical exam techniques and their ability to care for patients. Along with our collaboration with physical therapy and occupational therapy, there is a fall prevention center here at the health sciences campus. And I just think this is a really cool picture. But falls prevention is really core to keeping patients healthy and preventing them from having untoward events, but also keeping them out of the acute care setting. Part of the falls prevention, there is also an activities of daily living, or ADL lab, which mimics a a house. So it has a living room and a bathroom and a kitchen, and where patients can learn to be both rehabilitated, but also students can learn how to transfer, how to work with patients in a non-acute care setting. So this is a prime example of how we can use multiple professional facilities to educate nurses here at Emory and Henry. This is some of our regular hospital-like acute care facilities, lab where we have respirators and all the kinds of equipment that you need to learn to work with as you develop your acute care skills, as well as long-term care sometimes, as well as, you know, the isolettes or the bilirubin light for infants, delivery. We have a high fidelity mannequins who actually deliver babies and have a variety of simulated experiences when things go right and when they don't go as right, and how we can train our healthcare professionals to be prepared to be able to respond to all kinds of situations, as well as the right after birth and taking care of those newborn babies under the baby warmer and being able to bond with the mom. So moving them through what happens in real life and giving them an opportunity. And I should also kind of say, one of the reasons that simulation is so critical, and it predates the COVID where we've had challenges with having learning opportunities within healthcare facilities because of the pandemic, but also simulation is a way to prepare students so they have real life experiences before they actually have to touch real patients. So it's safer for patients, but also it provides an opportunity to prepare students to attend to those unexpected or maybe critical events that they may not actually get a chance to see in their clinical rotation. So we can actually predict and prepare those situations so they can have that experience before they really enter real practice, real life. And so we can simulate breath sounds, bowel sounds, how a patient responds, how they may have a critical life event where they may have it may deteriorate clinically and they need rapid response. And so we can create these scenarios so that students learn in a safe environment, and we can predict and prepare multiple simulation experiences with multiple outcomes. And so students get direct feedback, such as maybe that wasn't the best decision to make, that wasn't the best next step. So we can back up and say, okay, let's go through how this patient is presenting, and let's go through what is safe and how to respond in the clinical setting. And this also prepares students for what is going to be the next generation of NCLEX. So the NCLEX is the national licensing exam for registered nurses. And it will be the new version of it, called Next Generation, will be starting in the spring of 2023. And part of that next generation really asks the examinees to apply real life critical thinking, not just answer questions, but to go through and apply critical thinking in order to pass that exam. And so there's more and more emphasis that we're preparing healthcare professionals, and particularly registered nurses, that are ready to step in and start practicing day one in whatever employment or organizational facility they're in. So we talked about that also on our campus is the Mel Lehman Free Clinic. So this gives us also a real life opportunity to interact with other healthcare professionals in an educational environment, and providing services to our community and to patients who may come from the community on a sliding scale fee and not processing insurance. So it gives patients a good opportunity to access healthcare, and for students in a supervised environment to be able to deliver healthcare and work together and be educated together in terms of physical therapy. There's dental clinic, occupational therapy, physician assistant. So a number of different disciplines, and learn to work together in a real setting. Our faculty includes many adjunct. We've had a registered nurse to BSN program, and we will expand our faculty as we roll out our programs. But what we really bring is a small and mighty team who has a deep experience in terms of their professional experience as registered nurses, I myself as a nurse practitioner, as well as educators. And so collectively, we have over 60 years as nursing educators and over 100 years of nursing practice. So we didn't just start yesterday. We have got a lot of deep experience and applying that to real life. So not just the book, but being able to apply it to real clinical settings. So Dr. Sandra Farmer is actually credited to being the founding chair of the BSN program and is credited with really getting this program up and ready. Dr. Teresa Wexler was able to join us as recently as December, and she brings a wealth of clinical simulation experience, as well as she is the head of our interprofessional clinical simulation laboratories, as well as nursing faculty. So we have a lot of good experience to be able to roll out this program. It's a new program, but we're excited and have a lot of enthusiasm and energy because we believe in the power of the liberal arts curriculum infused with nursing education, as well as state-of-the-art science and health professional provision and educational programs. And so we think we really are combining a wonderful opportunities we launched this program. So we currently have a BSN program that has 2 tracks. So we have the registered nurse to BSN. So that prepares registered nurses who have either a diploma or an associate's degree in nursing and prepare them at the Bachelor's of Science in Nursing. And the Bachelor of Science in Nursing provides career enhancement and other broader opportunities. But besides that, you might say, well, why would I want a Bachelor's of Science in Nursing instead of going to get an ADN to start? The reason is there's increasing body of research that supports that patient outcomes and patient quality and safety is improved the more the nursing staff are prepared at the Bachelor of Science in Nursing level minimum. And then there's Master's of Science and doctoral preparation in nursing. And so more and more, we know that if we educate more nurses at the Bachelor of Science, we're going to improve patient outcomes. And healthcare facilities, while they've been, a lot of healthcare organizations have been really desperate for all licensed registered nurses because of the pandemic and because of nursing shortage, they'll be increasingly wanting to have those nurses prepared at the Baccalaureate of Science level. And so we have a way to move nurses through and to get a Bachelor of Science degree. They can bring in up to 75 credits, as well as 39 of those may be in nursing credits. And so they can get their Bachelor's of Science in nursing degree in as little as a year, although that's pretty rigorous because that means it's difficult to keep working as working professionals. But our program is delivered in an online as well as options for hybrid and on-campus opportunities. And so that allows the working professional to come back and get their Bachelor's of Science degree. And what we're starting in the fall, this fall of 21, is a traditional, they call them TBSN, or pre-licensure program. And that's where a student comes to Emory and Henry College as a freshman and starts taking those prerequisite courses that are required to apply to the nursing program. So you indicate that you're a pre-nursing desire, and then in the fall of your sophomore year, you will be able to apply to the School of Nursing to be applied to be accepted into the nursing program. Some programs have a 2+2, meaning they have 2 years of prerequisites, and then you start in your junior year. We are starting in the spring of our sophomore year so that you will still continue to have some of your core, your liberal arts content while you're progressing through your sophomore, junior, and senior year, but you're also being able to get right into nursing and have clinical nursing experiences so you can really see what it's like to have a nursing career. And when you finish and you graduate from Emory and Henry, which you can do in 4 years, or you have that rich liberal arts education and critical thinking and oral and written communication skills, but you are eligible then to sit for the NCLEX, as I referred to before, the Registered Nurse National Licensing Examination. So you will have a Bachelor of Science degree and you'll be eligible to sit for that licensing exam to prepare you and license you as a registered nurse. And then the world is open. It's very, very hard to be unemployed as a registered nurse. And there's a variety of settings. And one of the wonderful things about nursing is you may start out in one setting and you may move from a med surg setting, you may move to a psych mental health like Dr. Farmer has done. And that area, you may move to a critical care emergency, you may move out of the acute care setting. You may want to practice in the community and more population health areas. You may want to do home health. You may want to work in long-term or skilled care. One of the things that the pandemic has identified is both internationally and nationally, we have underfunded our public health and our community health programs. And there's going to be increasingly an emphasis, both because of the pandemic, but also because we need to keep people out of the hospital. We need to keep them out of acute care. Think of that as the mechanic garage where you get your car repaired. We want to prevent you from getting there. So providing more and more services in the community and improving population health is going to be increasingly a focus for all healthcare and all nursing programs nationwide. And so by coming to a bachelor's of science program from the beginning will help prepare you for those other opportunities. So I'm going to ask Tracy Harrison to now explain the process with applying.
Absolutely. Thank you so much, Dr. Ferguson. So I do know that we have a good mixture of attendees today. Some of you have already applied and been accepted. Some of you are enrolled for the fall semester, and some of you are current students, and some of you are still in high school or looking to join us in a couple of years. So just a good overview of applying to Emory and Henry College. Our application is available online, both through our webpage and also through the Common App. We are test optional, and we will remain test optional for the foreseeable future. So that means we are not going to require SAT or ACT test scores. The only thing we're going to need is your high school transcripts. We do have a rolling admission. So what that means is once we receive your submitted application and your transcripts, usually within 24 to 48 hours, your admissions counselor is reviewing your application and will be following back up with you with an admissions decision. We highly recommend that all of our students file a FAFSA. That is going to be a free application for federal student aid, and that opens the door for numerous different need-based aid that you can receive both from Emory and Henry College and also from the federal government. We offer additional affinity and performance scholarships. And then we also, like I said, offer need-based scholarships as well. Once you are accepted and we have received your FAFSA, then you receive an award letter from our financial aid office that will break down your merit scholarship that you are awarded at the time of acceptance, any institutional aid that you are eligible for, any federal aid that you are eligible for, and then if you are a Virginia resident, any state grant that you're eligible for. If when the time is ready, you make that decision that yes, absolutely, Emory and Henry is where you want to attend in the fall semester or in the spring semester, we do have a non-refundable $200 enrollment deposit to secure your spot. And then as Dr. Ferguson said, into your sophomore year here, you will have the opportunity to apply to begin the nursing program in the spring of your sophomore year. Next slide. And this is just a good overview of the different financial aid not only offered by Emory and Henry College, but also by federal government, state grants, outside sources. We do have work study and student employment available on campus. And then we also accept AP, IB, and community college and other college transfer credits. If you want to get a leg up on finishing some course credit that you can get credit for with us to get some of those prerequisite classes out of the way. And then these are our student costs and fees for this upcoming academic year. 100% of our students receive financial aid. We have merit scholarships that are awarded based on your current GPA, and they range from $10,000 to $20,000 per year, and that's for all 4 years, as long as you're a full-time student and maintain good academic standing. The average aid that our student receives is roughly around $29,000 per year. Our tuition, which has held steady for the past 5 years, is at $34,500. And then we have our average housing and our meal plans, our student fees, and then the average out-of-pocket cost of attendance for our students. And there are, for nursing students, there is additional financial aid support for nursing students. We have a very extensive list of those opportunities that are available for nursing students. We also have on here, if you're coming in for the RN to BSN program, what the tuition is as far as per credit hour. And then I will let Dr. Ferguson speak to any of these specifically, and then we can wrap up and we're open for questions.
So I would just like to follow up with reinforcing that not only are there multiple career opportunities for nursing upon graduation, and so you won't be unemployed by choice, but there is great support. So there's HRSA, which is a federal government agency, Health Resources and Services Administration, provides both scholarships as well as scholarships once you're in the nursing program, as well as when you graduate, has loan forgiveness programs. And I can tell you, I personally have benefited from that over my career. So it's not about just acquiring the debt. There's going to be ways to get those loans if you acquire loans during your educational program. And this applies to any of the program, any school that applies that receives federal aid, but also this is just an opportunity for nursing education and how the government supports, as well as many healthcare organizations in their need to recruit qualified nurses may support students through their program if they make a commitment to come work in their organization upon graduation. So sometimes there's regional support in healthcare organizations, and we can direct that as appropriate when you're in the program. And I should sort of just clarify, when you apply to Emory Henry and you're a student here at the college, we will work with you in advising with any pre-health and pre-nursing together. But when you apply to the nursing program in the fall of your sophomore year, you'll have to take an admission exam at that point. And that helps us be able to evaluate your preparation in terms of the sciences and your success in the program, or perhaps what remediation or opportunity would help support you being successful, as well as an interview and a background check, which was required for you to be able to do your clinical experiences. So that's part of the admission to the nursing program. But then we will give you an answer within 6 weeks so you can start in the spring of your sophomore year directly in the nursing courses and in nursing clinical experiences. So we're happy to have you connect with us. And I know that everybody's going to receive a recording of this presentation so you can refer back to it. But please feel free to reach out to us, give us a call or send me an email, send Dr. Farmer an email. We will follow up with you. We'd be happy to set up a meeting. If there's lots convenient, we'll come and meet with a group or meet with you individually to help answer your questions more specifically. But right now, we're also happy to answer any questions that you have at this time.
We do already have one question. So it is, what are the prerequisites for traditional BSN, and does the school look to going to have an accelerated BSN?
So the Virginia Board of Nursing is very clear about what is required in terms of nursing courses and the prerequisite courses in the sciences. So we have a program, a study that gives you a very clear outline of what you need in terms of general biology, microbiology, chemistry, anatomy and physiology 1 and 2, as well as our liberal arts curriculum, which includes, and we're very proud that we have a medical Spanish. And so you have to take a language at Emory and Henry, We're hoping to have expansion in our language opportunities, including American Sign Language. So you get that as well as general intro to psychology, as well as developmental psych, all those other prerequisite. And we have, so we have a specific program of study which we can share to show what your choices in terms of electives or different kinds of courses within the liberal arts curriculum, and also the courses that you need before applying to the nursing program.
May I interject something here, Dr. Ferguson? Hi, everyone. I'm Dr. Sandra Farmer, and Dr. Ferguson has told you about me, but you know, I would love to be able to speak with you more on a one-to-one basis on what requirements you have. You know, I ask that you send me transcripts if you have some college transcripts. That way I can kind of plot out what would your program of study look like? What do you still need? You know, what are we looking for? And I'll, as well as determine too, what classes will be the ones that will likely transfer in. So again, my contact information is on here. So please feel free to reach out to me by email.
And to answer the other question about accelerated program, we do hope to do that in the near future. Obviously, if you have a undergraduate baccalaureate degree in another discipline, we can put you in, you know, you may qualify to get right into the nursing program without taking any other additional courses at Emory and Henry. We would have to individually evaluate your transcript and your previous educational experience. Accelerated truly means we offer courses in a more rapid sense in 12 months, and we hope to do that. We need to enroll students to make that a reality. And so, yes, we plan to do it, but if you have a degree in another discipline, we can absolutely review your transcripts and plan a program of study for you.
What is the test requirement for admission to the nursing program?
Well, we are currently evaluating, there's two general ones. One is the TEAS and one is a Elsevier pre-admission test. And we have advertised that we're going to use a TEAS, but to be quite honest, we are as a faculty evaluating that right now, and we may change and use the Elsevier pre-admission exam. It'll be one of them. They're very similar. They test science knowledge, written oral skills, as well as critical thinking skills and math skills.
If you allow me, Dr. Ferguson, I have a question. My name is Kalala. I think that the last part of what you just said is what does interest me. I already have a bachelor degree and already also an associate degree, as I was trying to complete my prerequisite because I was planning to go to the nursing to UVA or Georgetown, but I end up seeing that Emory just opened a school of nursing for BSN, and I'm interested of joining Emory. But I have completed anatomy 1 and 2, microbiology, chemistry, statistics, biology, nutrition. In my case, what should I do?
Well, we would encourage you to reach out to myself or Dr. Farmer, and we would go through. Dr. Farmer is the expert at reviewing your transcripts and telling you what your options are and planning a program of study. We are starting a small class in January of 21, so there are opportunities to start earlier in terms of the nursing program. We are not able to accept transfer from other nursing programs, other nursing credits, as we have initial approval from the Virginia Board of Nursing, but we have to prove ourselves, right? So we will move forward with that. So we can't take nursing credit transfer, but we can take other transfer credits. And I should also say that we have just recently went through a site visit for our BSN program, which looked at our RN to BSN track. And that was successful, but we are waiting the complete approval from CCNE, the Commission on Collegiate Nursing Education, that we will hear in the fall, probably by November, as far as accreditation.
Yep, thank you.
Kalila, I would encourage you to send me your transcript and let me look over it, and then you and I can have maybe a Zoom time together to discuss more intent.
Thank you, Dr. Farmer.
You're welcome.
What other questions does anyone have? You're welcome to unmute yourself, and you're also welcome to type it over in the chat. We will stay on for a little while to give everyone a chance to be able to ask any questions. And again, feel free, if you think of questions after we're done this afternoon, feel free to reach out to any of us if you think of something later on. And then for Dr. Ferguson, Dr. Farmer, and Dr. Wexler, is there anything else that you feel like you should add in addition to that you feel is an important thing to know about the programs?
I would just like to say, you know, we're very proud of having our RN to BSN program. We'll be graduating 2 students in August who were our inaugural group. And who have done stellar jobs in their curriculum, especially amidst COVID and the strenuous requirements at their jobs related to that. And so I have to give kudos to those girls for really sticking with it and working very hard. But unfortunately, we're not able to get out and recruit like we have in the past. And I came aboard in 2018 and began the program, as Dr. Ferguson said. And the opportunity now to see nursing truly grow at Emory really warms my heart, for one, because we need nurses in this area so badly. And to be able to educate our own and to grow our own, I have said that many times, because we want you to stay here. We want you in this area. We want you to be taking care of me. I will need it. and I'll be your difficult patient, I promise. But, you know, to be able to be right here and to give back to our communities, that's huge. And with the opportunities that we have around, like Dr. Ferguson said, we've got the Mel Lehman Clinic, but there's so many others. We've got a mobile medical unit that we're going to be able to utilize in one of our courses. So you'll be out in the actual communities and dealing, I guess, primarily with homeless people and providing them healthcare. And I just think that is such a great opportunity. But I also want to add too that I knew at the age of 8 that I wanted to be a nurse. My grandmother instilled that in me. And I don't regret one single moment of my decision. And I have bounced around. I mean, I knew coming in to nursing, I didn't know what I wanted to do. I just knew I wanted to be a nurse. But then as I went through my clinicals and being very open-minded, I found my passion to be with psychiatric nursing. Back 100 years ago when I became a nurse, you know, we had to bide our time because that was a specialty. But, you know, and I did. And when I finally got into it, you know, I love it. I have cardiac background. I have worked in all areas within mental health as far as, you know, working with adults, working with children, working with adolescents, working with substance abuse. I've done the gamut. And I find my days in practice, and I can't wait to get back into practice because I haven't been able to since I came to Emory with starting a new program and stuff. So I'm anxious to get back into practice myself. But I'm like Dr. Ferguson. I love that patient interaction and the ability to spend time with my patients and to be able to talk with them and to, you know, help themselves. And so, you know, I've been a nurse for a long time. over 30 years, getting darn near close to 40 years, but, and I don't regret any of that time away that I have been in this practice. So I feel like those of you that are on this call, you're making a wonderful decision to come into the nursing profession. And that's what it is. It is a profession. Thank you.
Thank you, Dr. Farmer. So we have a couple more questions. Is there an opportunity for direct admit to the nursing program?
There is an opportunity if you've completed the prerequisite courses and you're transferring to Emory and Henry, you could apply for that first class or starting in the January 21. You can't transfer nursing courses from another institution, but you could be a transfer from another institution and have completed the prerequisite courses.
Will there be any shadowing or patient experience required in order to apply for the BSN?
No, we don't, it's always a wonderful opportunity if you have that. It's not a requirement for your acceptance into the nursing program. The nursing program will be based on your admission criteria, your GPA, your interview, and the admission evaluation. So obviously they can be competitive, but we want to have, we need to accept students that will be successful in the program.
And I would encourage those of you that, in taking the CNA course, and being exposed to the profession in that way, during the summer times and things when you can work. I just think that that's always a nice segue into nursing because it does expose you to different areas of nursing and what nurses actually do. And so I'll put a plug in for the CNA program also.
Yeah, so just to be clear, we actually have at Emory and Henry a CNA program. Some of the pre-health students who maybe not even are choosing nursing, they may choose another healthcare discipline, but they've chosen to go through the CNA program, so they become a certified nurses aide, and so they can work at that level in different healthcare organizations while they're in school.
And I would like to add, if I can, for just a moment. I'm Teresa Wexler. It's nice to meet you. And I just want to share a bit about what we offer here at Emory and Henry. There's an old saying that if you pick your passion, you won't work a day in your life. For myself, I never thought of being a nurse, so my passion picked me. And you won't find more dedicated individuals than our nursing team here. We're very united to offer excellence in education to you and compassion as well. We want to see you succeed. We want to see the program succeed, and that we're here for you. And you don't always see that. And if you would like to come by and take a look at our awesome simulation labs, you can contact me or Dr. Farmer or Dr. Ferguson, and we have to look and see if the rules on visitors and stuff with the social distancing stuff. But we can birth babies in there, and we have simulators that can talk and sweat and do all types of different things for you. So I just hope that you'll love nursing as much as we do, and you'll see that when you see us teach, because we absolutely love what we do. We're very blessed to be nurses, and the icing on the cake is we get to teach the profession that we love. So we hope to see you here soon.
Great. Thank you all so much. And if we don't have any other questions, we will go ahead and wrap up for this afternoon. Again, thank you all so much for joining us. And also thank you to Dr. Ferguson, Dr. Farmer, and Dr. Wexler in taking the time out of their, what I know is very busy days, to be able to showcase our new School of Nursing. I know I'm very excited to be able to offer this to any of our new incoming students. And again, if you do have questions or anything as you go through the process, feel free to reach out to any of us. And I hope everyone has a great afternoon. Thank you, everybody.
Thank you to you.
Thank you.
Thank you, and I look forward to hearing from you.